Morning everyone, and thank you especially to the members of the CF community who've travelled considerable distances to be here today. I know we have people from throughout the country, and it's fantastic that you could join us here in this fine Canberra morning, which is fantastic to see. I'd also like to welcome the members of Parliament who've been able to join us this morning, especially Senator Anne who is hosting us this morning, and Mr Ken White, who's from Western Australia, where I'm from. But I'd also like to especially welcome and acknowledge the Honourable Peter Dutton, Minister for Health, who's here representing the Prime Minister, Mr Tony Abbott. I'd like to really talk about today about how cystic fibrosis is a condition that leaves an enduring remark. And I know people have been speaking to the Minister this morning about their lives and about the impact that cystic fibrosis has on their lives. And as we come from the days when I'm actually a person who has cystic fibrosis, I'm, if you like, one of the outliers and the exception that proves the rule. When I was born in 1960, my parents were told that I wouldn't live to go to school and were told to take me home, love me, and then there was nothing really they could do. Unfortunately for the world, 54 years later, I'm still here. But what that did was, over that time, we have seen remarkable strides in cystic fibrosis because we begin to understand the disease. And back in the 60s, we started to understand that if we treated infection aggressively, people got better. In the 70s, we learned if we actually used nutrition properly, people got better. If you have good nutrition, you have an opportunity to live better. In the 80s and 90s, in the 80s, we discovered the gene that causes cystic fibrosis, and that was a great breakthrough, and we thought all the answers would come immediately, but unfortunately, the more we knew we didn't know. But in the 90s, we also started to have some new treatments where we were able to change the antibiotics so they could be given to people in an ongoing basis. So instead of having to go into a hospital all the time for intravenous antibiotics, we've managed to use nebulizers, and we started to inhale medicines. There were some other drugs that helped thin the mucus. And so all of those advances means that people today who are born with cystic fibrosis are going to live well into their 30s and hopefully beyond. But until now, the only things that we've been doing is ameliorating the symptoms. All the treatments for cystic fibrosis have been about symptoms of the disease and not actually fixing the basic problem. We're lucky now that we've started to find out the mechanisms of the disease, and we have finally come up with a drug called Kalydeco, which is the very first drug ever to treat the underlying cause of cystic fibrosis. Unfortunately, for the majority of people with CF, that won't work for them, but it gives us an understanding so we can now build on that and go to develop, hopefully, newer, better treatments for everything. But what we do have is a group of about 200 Australians whose lives would be changed forever by having access to that medicine. Unfortunately, though, that drug costs around about $300,000 a year, and if you think about that, the cystic fibrosis population really can't afford to pay that because they'd have to mortgage their house, or perhaps every 2 years it would be the equivalent of a new house. So we have a system in Australia that is wonderful, the Pharmaceutical Benefits Scheme, and what we're now looking to do is have that drug listed on the Pharmaceutical Benefits Scheme. CF Australia has been working constructively with the company that's doing that. It's also been working constructively with the Minister and having discussions with the Minister and keeping him up to date with our community. We've also been working with the Department of Health to really lay out why this is so important for people and what the difference will be in people's lives. But unfortunately, we're still not at the point where we can say yes, everybody's a yes to Kalydeco, which is one of the mantras that's been said. We want to say yes to Kalydeco. Unfortunately, it's not there. About 90% of the eligible population in the developed world has access. If you're in the United Kingdom, Europe, most of Europe, or the United States, then many people get access. But unfortunately, we still don't have that here. And I think I've got a couple of messages that I'd like to relay today at this event this morning. And the first one is to Vertex. The cost of your therapy is too high. Regardless if you believe the Australian government is getting a good deal or not, the price as it stands is obviously not considered good enough and that's why there is things being put on that, and the PBAC has decided that there is a list of things that should be done and risk sharing between the company. If it's as good as the company says, then they'll get the price. So we implore Vertex to sharpen their pencil and negotiate for better outcomes for people and not profits. Equally though, I say to the federal government and the Minister for Health, this therapy is the best opportunity for a healthy life that we've available to us. It's the first time ever. We understand that government's in a tight situation. We also understand that the PBS costs around about $9,000 million per year to the Australian taxpayer. But we need the government to understand and the department to understand the parents' anguish for their child's long-term health and their long-term outcomes. We don't want to be talking about people with cystic fibrosis surviving into their 30s. We want to be talking about people with cystic fibrosis having the same life opportunity as everybody else. And our vision for cystic fibrosis in Australia is lives unaffected by cystic fibrosis. And this drug will help us take one step closer to that. With that, I'd like to invite the Minister to really talk about the health of all Australians, and especially those people with cystic fibrosis, because I know he has been actively and keenly engaged with the CF community since his time in opposition and also his time as a Minister.